we often have this idea, and many patients experience this, when you go and you do a jog, you go on a long walk, you feel mentally clearer, you feel sharper, your stress goes down. And that's not just a feeling, that's really something that we can show biologically.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hello, everyone. I'm your host, Sandra Peebles. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched health questions on trending topics. Today, we're exploring one of the body's most powerful links, the one between your heart and your brain. These two organs depend on each other more than you might think, from how your blood pressure can shape your memory to the daily lifestyle choices that keep both strong. We're uncovering science behind this vital connection. To help us link the heart and brain, we've brought together two experts who know both ends of that story. Dr. Marcus St. John, interventional cardiologist at Baptist Health Miami Cardiac and Vascular Institute, and Dr. Nestor Beltre, neurologist and movement disorder specialist at Baptist Health Miami Neuroscience Institute. Welcome, gentlemen.
Thank you.
I'm excited to have this conversation. So there's a lot that's said about what's good for the heart is good for the brain. So Dr. St. John, from a medical perspective, what does that really mean?
So it means that the heart and the brain share a lot of common risk factors. So when we talk about a risk factor, it's something that increases the chances of you developing a health problem with a particular organ, such as heart attack or a stroke. So some of the usual risk factors for heart disease include high blood pressure, high blood sugar, high cholesterol. All of those are also risk factors for stroke and brain disease. So that's what we mean by there are a lot of shared risk factors for the heart and the brain.
Dr. Beltre, how exactly are the heart and the brain connected? So can you walk us through how blood flow and the nervous system link these two powerhouses?
Absolutely. So the brain really needs a healthy blood flow in order to work correctly. And we know from multiple studies that high blood pressure, for example, can lead to a higher risk of having dementia and cognitive issues later in life. And patients that have cardiac disease often have cognitive symptoms. So having a healthy heart is having a healthy brain. And I often tell my patients heart health, the same things they know about exercise, blood pressure medications, controlling your cholesterol, is also brain health.
And Dr. St. John, how important is it to think of these organs in unison? In other words, not to think of my heart health as separate from my brain health, but how do we bring these two together and create awareness of that?
Yeah, I think as Dr. Beltre is highlighting, everything that you do that is good for the heart is good for the brain. And I think for each individual patient, focusing on what their highest priority is will often be our best way to get them to take good steps that will be good for both. For instance, I see many patients whose biggest concern is, well, mom or dad had cognitive decline, or my brother just had a heart attack. So we leverage their interest, their concern, get them to take healthy behaviors, and they will be helping both their health, their heart, and their brain.
Their heart health and their brain health, without a doubt. Dr. Beltre, a lot of people think that having low blood pressure is actually great for your health, but is there actually a relationship between blood pressure and brain health? Can we be even talking about dementia here?
Absolutely. So there was a large trial called the Sprint Mind trial that looked into this question. And they saw that patients that maintained their blood pressure in the normal range had lower risk of having cognitive impairment or cognitive symptoms later in life. And we know that higher blood pressure can lead to strokes, which can sometimes be silent, but over time can accumulate and lead to a lot of the same problems that like Alzheimer's, like trouble with memory, forgetting the names of close family members, trouble walking. And a lot of these things are preventable. And is one of the strongest, most preventable risk factors we have for cognitive impairment.
So let's get into actionable tasks, because people always want to know, what can I do? And the Mediterranean diet is always mentioned when it comes to longevity. So what makes that lifestyle or that type of diet, that style of eating, such a powerful tool for the heart and the brain?
I think the Mediterranean diet and lifestyle sort of focuses on a lot of things that are good for blood pressure, that help lower cholesterol. So it is low sodium, it is very low processed, it is low in saturated fats. It highlights the importance of vegetables and fruits. It limits the intake of animal protein. And these are all sensible, heart healthy and brain healthy actions. And I think when we think of that lifestyle, we think of spending time with family members, of exercise, of walking after dinner, all good things to improve your chances of keeping your risk profile for stroke, heart attack, and other diseases low.
And I love that you mentioned that, because when I asked you the question, I said Mediterranean diet, but you said Mediterranean lifestyle, which includes that exercise and the family togetherness, right? Community.
Yes.
It has been proven that is so important for our overall health. So let's talk about movement, Dr. Beltre. And we know that exercise keeps the heart strong, but what does movement do for our memory, for our mental sharpness, for focus? What does it do for the brain?
Right. Exercise really is like a fertilizer for the brain. So we often have this idea, and many patients experience this, when you go and you do a jog, or you go on a long walk, you feel mentally clearer, you feel sharper, your stress goes down. And that's not just a feeling. That's really something that we can show biologically. So exercise increases blood flow. It takes away toxins that accumulate throughout the day in your brain. And we know, for example, in Parkinson's disease, it's the only medication or intervention that slows the progression of the disease. So it really is super effective. And even without weight loss, exercise has huge benefits both for the brain and the heart.
It's so interesting. So weight loss isn't necessarily the goal. It's the actual movement to get that blood literally and that oxygen to the brain, to the heart.
Exactly. Well, it's dependent on each patient. But if you're a patient that's doing exercise, has started walking, but the scale is not changing, you can still be assured that you are doing something that's good for your body, and it is making your heart stronger and it's making your brain healthier.
And that's so important, because a lot of people might feel like, I can't lose weight. I can't lose weight. Why exercise? Exercise, move.
Yeah.
We need to keep moving.
I want to highlight, if I could, I say this to my patients almost daily. Exercise, even without weight loss, is worth it. So get moving. And don't focus only on the scale. And I love what Dr. Beltre say, that exercise is fertilizer for the brain. I say in my practice to patients, exercise is the fountain of youth.
Absolutely.
People always want a shortcut or a pill or this and that. Get moving.
The only true fountain of youth. I'm glad that we're saying all these things to motivate people, right? Don't say, oh, if I don't lose weight, I'm not going to do it. Do it. Get out there and move.
Absolutely.
So let's talk about cholesterol. Many people in their adulthood have a high LDL levels during early adulthood. That is now being linked to dementia. So is it ever too late to start making lifestyle changes, Dr. St. John?
No, never too late. Never too early also. So just for the audience, LDL is bad cholesterol. The HDL is the good cholesterol. We focus mostly on the LDL when we're thinking about cardiac and brain risk. All of the elements of the Mediterranean diet, the exercise, the movement, those are all things that will help you lower your bad cholesterol, will lower your LDL, and that's associated with a decreased risk for heart attack and other conditions that people care about.
Okay, so Dr. Beltre, this is an area I'm very passionate about, and it's our emotions and how they register on our health, right? So we know that stress and anxiety can definitely affect the heart, but can they also affect our mental focus, our clarity? Do our emotions affect our organs?
Absolutely. So we know from, there is a clinical syndrome called pseudo-dementia, which is where a patient, pseudo means fake and dementia means, having cognitive issues. And there's patients that will walk into the clinic and their families and the patient will be concerned that their memories, either forgetting things, losing their keys, getting lost on the way home. And it can look a lot like Alzheimer's disease. But the actual cause is simply depression and anxiety can mimic many of the same symptoms of cognitive impairment. So if a patient is struggling with these symptoms, it's important to address that early, whether that's psychotherapy or medications, changing in lifestyle, because the longer you're in that state, that is causing injury to the brain and is affecting your ability to focus and be more engaged with your family. And that can have a cycle, create a spiral of worsening brain health over time. So it's really important to address these symptoms early.
And exercise here also is a factor, right? It helps with depression, getting out there, not being lonely, not being locked up.
Right. Absolutely. Exercise is incredibly important. And I tell my patients, some patients, they're not ready to start a medication yet. And I say, what you can do that's just as effective as a medication is getting out, doing exercise, and speaking with therapists, and also speaking and reaching out to close contacts like close friends and family. And that can be a very effective first step.
Let's remember that we do this show based on the most asked questions. So these are trending topics, and we get questions from moms that speak about having that mom brain fog or mom brain. Could heart health or circulation play a role in that too for moms that are busy or distracted or really overwhelmed with so many tasks?
I think that is less likely to be a sign of any sort of heart disease, to be honest, and more likely to be a sign of sort of chronic sleep deprivation, maybe hormonal fluxes with recent delivery, and stress and anxiety that Dr. Beltre was just talking about. So less likely a sign that there's something wrong with your heart, but all of those other important factors are likely contributing to that mom brain syndrome.
Sometimes we think that the heart disease is a man issue. And obviously, it affects so many women. What should women look out for that might be different than symptoms for men, Dr. Beltre?
Right. So, there's certainly the narrative in the public for many decades that heart health is a men's issue, but we know women are just as likely to have heart disease, and many of the symptoms go under-recognized. So women often will have recurrent shortness of breath, trouble breathing, they might have nausea, they might have a chest pressure that's not quite that sharp left-sided chest pain that many of us have heard about to identify as a heart attack. So if you're having these symptoms, it's important to reach out to your medical providers. And if it's really severe and you're having trouble breathing and functioning, you should go to an emergency room and make sure that they do an appropriate workup because we want to identify these issues early.
And it's very important to get people to actually do that. So I'm glad to be having this conversation because a lot of women might think, oh, it's okay, it's just slowing me down, but I'm busy, I have things to do, and we all have things to do. So they might not really pay attention to it, but you're saying really, if you feel a little bit tired or you feel some of these symptoms, really go and go get it checked out. Can a healthy brain exist with an unhealthy heart? Or can there be poor heart health and healthy brain? Or are these codependent, Dr. St. John?
They really are codependent. So healthy behaviors, healthy numbers translate into good health for both your heart and your brain. So, we see patients in my practice who've had strokes, and Dr. Beltre sees heart attack patients and arrhythmia patients. And there's really just an overlap between these two organs, and the actions that we take that help one or the other or hurt one or the other invariably can affect both. So heart health is brain health.
Okay, so we spoke about some of the things that we can do, eating healthy, having community, exercising, obviously movement, but the internet is full of information on supplements that can help our brain. I've seen it, and of course we all want that. We want a clearer brain and more focus. Is there any truth to the claims with these supplements, or are there actually some supplements that can help us?
So I usually recommend my patients be cautious with many of these supplements. Many of these companies are making a lot of promises that aren't supported by evidence, and there can be a significant financial cost with many of these medications. But the best thing is to speak with your physician, make sure you have an open-ended conversation about the supplements you're taking and have a discussion. Many of them are safe, but some may have interactions with medications or may have health implications as well. And I always tell my patients, if you're paying for a supplement and that's getting in the way of you doing something that's more effective, like paying for a medication or having an exercise routine or having a gym membership, that's where I recommend that they don't pursue these options. But if it's a relatively safe medication and it's not having a significant financial burden, then I think it's up to the patient's discretion about what they want to take.
And maybe definitely come to your doctor, bring the supplement and kind of consult it with your doctor, because you would know if it interacts, or maybe even the pharmacist.
Yes, the pharmacist is actually an excellent resource for many patients.
Yeah, we have to check things out. Okay, So this question is for both of you. I know that here at Baptist, there's a lot of collaboration between the cardiology team, the neurology teams. Can you share how your partnership works in your practice and why combining these is so important for the patient outcome? And let's start with you, Dr. St. John.
Yeah, so we work together very commonly, oftentimes in the acute setting when patients come in with a stroke or a heart attack, one or the other complicated by the other. So we're very often caring in real time for patients undergoing acute challenges. And then in the outpatient setting, we commonly collaborate. We call each other if there are certain things that maybe we want to talk about for each individual patient. So there's a lot of cross-pollination. We also have, huge staffs of folks who work with us, the social workers, the physical therapists, the occupational therapists, and those types of additional healthcare providers actually work within both spheres of the Neuroscience Institute and the Cardiac and Vascular Institute. So there's a lot of overlap and commonality.
So, Dr. Beltre, from your perspective, same question. Tell me about the collaboration between the neurology team and the neurology team here at Baptist.
Well, that was very well stated, especially on the inpatient side. There's a lot of collaboration. We're often consulted on the same patient, particularly with stroke and irregular heart rate or high blood pressure that's difficult to control. There's also in other areas of neurology, such as in Parkinson's disease, patients can develop over time low blood pressure and issues with their cardiovascular system. And often we're reaching out to our cardiology colleagues to help us manage the patient together so that we can have the best care for that patient. I think that really improves patient care because many patients want their physicians working together and being on the same page and having a unified front on how to do the best for that patient.
Well, Dr. Beltre, Dr. St. John, thank you so much. I think that empowering people with this information is so important. So thank you for the work that you do here at Baptist Health. And it's been a great conversation. Thank you for sharing the insight with our audience. And remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.